Dr. Yaffe, board certified radiation oncologist, discussing in this video treatment options for low risk category of prostate cancer. And these are surveillance prostatectomy, that's the surgical removal of the prostate gland, external radiation therapy, and brachytherapy. So, surveillance when a treatment is not given, but instead the patients are closely monitored. And generally, this involves this is only for very low risk patients, patients that have Gleason 6, PSA less than 5, and less or 2 positive cores in their biopsy sample, usually out of 12 or less. So 1 or 2 cores only would be candidates potentially for active surveillance, and it's for men with generally less than a 10-year life expectancy. The protocol of active surveillance involves checking a PSA every 6 months and a digital rectal exam once a year to make sure that the cancer is not worsening. And the prostate is biopsied every year to make sure that there's no worsening of the cancer. Concerns with active surveillance include the fact that we know that the biopsy underestimates the Gleason score in half of the patients. So in half of the patients with a Gleason 6, they may potentially have a Gleason 7 in the prostate that we don't know about. So it's a concern that we may be watching someone that has a worse cancer than what we think. And another concern is that the prostate cancer can progress or worsen or grow during the surveillance period. Another option is surgical removal of the prostate gland called prostatectomy. That is where the prostate is removed, and so the urethra that is in the middle of the prostate, the urine drains from the bladder, essentially through the middle of the prostate and out. The urethra needs to be reconstructed after a prostatectomy, and that results in some urinary symptoms. So low-risk men, all of the treatments have better than a 90% cure rate, whether it's surgery or radiation. But surgery is associated with urinary incontinence, that's the inability to control urination, and a Foley catheter is in place, usually 3 or 4 weeks, and the incontinence, it gets better over a 3 to 6 month period, but that's a side effect. And erectile dysfunction, the inability to achieve erections, occurs in about half of the patients. That largely depends on the baseline erectile function. Another option is external radiation therapy. This is where the patient is given radiation externally. The patient lays on the table, radiation machine rotates around the patient and shoots X-rays into the prostate gland. You cannot feel or see the radiation as it is going into the body. External radiation is usually Monday through Friday for 8 weeks. Each treatment is approximately a 30-minute commitment door to door. The side effects for radiation do not include incontinence like in surgery, but instead the opposite, urinary frequency. You tend to pee more often, and that goes on for several months. Medication can be used to control that. The reason for it is because the prostate gland is right here, and as we radiate the prostate gland, there's some swelling here, and it tends to make the flow from the bladder through the prostate tighter. So you tend not to empty the bladder as well. You can also have erectile dysfunction from radiation, but it's usually manageable with medications, and it also largely depends on the baseline function. I'd say it's about a 50-50 that erections are potentially worse with external radiation. Damage to the rectum or bladder is very unlikely with modern technology, and I would say it's pretty rare, less than 5% risk for any damage to the bladder or rectum. And The urethral stricture, that scar tissue developing in the urethra right here, it's about 10% risk with external radiation. Another type of external radiation is stereotactic radiation, also known as cyberknife or SBRT, stereotactic body radiation therapy. This requires specialized equipment and experience, and this treatment involves a high dose of radiation that's given in 5 treatments, usually 1 treatment every other day. But it's a very high dose. You're essentially getting a full weeks of treatment in 1 day, and you have to have a experienced radiation oncologist doing this because the immobilization and the treatment accuracy is critically important for stereotactic radiation. Another treatment is brachytherapy, otherwise known as a seed implantation. It's a 1-hour surgical procedure done under anesthesia in which tiny radioactive seeds, pictured here, are inserted into the prostate gland, and this is a minimally invasive 1-hour procedure, and these radioactive seeds then give off radiation from inside of the prostate itself. So this allows us to give a much larger dose to the prostate gland because the radiation doesn't have to go through the body, but it goes directly to the prostate gland. And it's very little radiation that is seen by the bladder or the rectum with a seed implant. And in experienced hands, it's a very, very effective treatment. Low-risk prostate cancer, all of the treatments, I would say, are associated with cure rates greater than 95%. You really have to determine what treatment is best for you based on the side effect profile. And so, to summarize it, surgery is associated with incontinence and erectile dysfunction. External radiation is associated with frequent urination and erectile dysfunction to some degree. And brachytherapy also, frequency, temporary, and erectile dysfunction. Those studies have shown that probably brachytherapy is the least damaging in terms of erectile dysfunction when these 3 treatments were compared head-to-head. An analysis of these 3 treatments has been done by the Prostate Cancer Center of Seattle, and although there's no direct head-to-head study that has compared this in a randomized fashion, which is the highest level of evidence, they've taken the studies, published studies, and have plotted them all on a graph. And so the red represents surgery, the green represents external radiation, and blue brachytherapy. So basically, what this shows, all of the treatments tend to cluster around 90% or better. So what this shows is that for low-risk patients, all 3, surgery, external radiation, and brachytherapy, are good treatments with high cure rates. Thank you very much for watching this video. Next, we'll tackle the treatment for intermediate risk patients, and please give a thumbs up if you enjoy this video.